All right, Zorba Paster standing by, ready to take your calls. We got a lot to get to. Let's start with Terry in Watertown. Hi, Terry. What's your question?
You talk about the Pfizer shot, that everybody's got to take that one. What about the Moderna shot? Do we have to take that one too?
No, it's either Pfizer, Moderna, or J&J. The Pfizer and Moderna are 2 shots. The J&J is a 1 shot. And they're all separate. They're all either A, B, or C.
So if you got the
Pfizer,
Pfizer,
you don't take the other.
You don't need the other one if you got the...
By no means.
All right. Thank you for calling. Let's go to Virginia in Madison. Hi, Virginia. What's your question?
Hi. My question is, I'm planning on traveling to Florida with a group of friends that are fully vaccinated. And when I come back to Madison, do I have to quarantine for 10 days before I can be around my family? That's
Good question.
Basically, wear a mask, of course, when you're in the airport, when you're traveling. If you have any questions when you're in Florida, wear a mask. But there's no reason to expect that you're going to get COVID. If you've got symptoms, get COVID tested. But in that, you do not have to quarantine.
Are you driving or flying?
We're flying.
Okay, yeah, wear a mask on the plane and in the airport.
And have a safe trip.
All right.
That's right. And enjoy.
Yes. All right, let's go to Ronald now in Stoughton. Hi, Ronald. What's your question?
I was wondering, I got my first shot in February. I heard that after 6 months you're down to 50% protection. Is that true, or how's that work?
No, that is not true. We don't know when the protection drops. We don't know if it drops. People who have illnesses such as an autoimmune disease may not actually receive the full benefit of the immunization. But right now, as far as we know, the immunization lasts. Whether you will need a booster has yet to be determined. But right now, you're safe, even though you got it in February.
But you need both shots.
Right. Got to have both shots. Right. If you only had one, you are not safe. I'm assuming you had the second one. If not, you need to get that second shot.
Yes, I've had 2, yeah, right.
Okay.
Good.
All right, good.
All right. Thank you for calling. Let's go to Sarah in Milton. Hi, Sarah. What's your question?
Hi. I have an adult son that's disabled, and he was damaged from the DPT shot when he was a baby. My question is, does it have any mercury in it, and am I safe to give it to him now? He's going to be roughly 40 years old.
Sure. Does not have mercury in it, and it's totally safe, and it's what's recommended. So definitely, he should get the shot. No doubt about it.
All right. Peace of mind there. All right, Della in Evansville. Hi, Della. What's your question?
I'm a diabetic, and I was wondering if I would need the booster.
No way of knowing that yet. CDC has yet to give the guidelines. This is basically, we think, for people who have a reduced immunity, such as if they're on cancer drugs, anti-cancer drugs, and so on.
Yeah, so right now it's just for people with compromised immune systems.
Right. The FDA has not given the guidelines yet, but it's a compromised immune system. If you're a diabetic, your immune system may still be up to snuff.
All right, very good. Let's go to Jan in REECEVILLE. Hi, Jan. What's your question?
I would like to know, I came back from vacation. It's almost a month now. It was the 13th of July. My husband and I and our daughter and grandchildren went to Texas, and we came back on the 20th, and the following weekend, which was the 24th, I started getting this bad, like a flu, like a cold. Mm-hmm. And I went to the ER because we thought we should be tested for COVID, and we don't have it. My husband and I did not have it. I went 3 times to be tested for it. I went that weekend, and then a couple days later, and then on Friday I finally went to my regular hospital I go to. And it came back, and I didn't have it. But
so I think you're okay then.
Yeah, you're okay. You don't have COVID. You probably have a viral infection that is not COVID. That's most likely the thing. But if you've been tested those numerous times without the COVID, chances are 99% you do not have COVID.
All right, let's go to Barbara in McFarland.
Yes.
Hi, Barbara. Go ahead.
Hi, this is Barbara in McFarland, and I had the Pfizer vaccine in February and in March. In May, I had an antibody test, and it came back negative. And I was told that meant that I had no antibodies to fight against the COVID virus. What do you feel?
Well, first of all, I would get tested again. And second of all, if you don't have antibodies again, you're probably one of those people who needs a booster. That's what I would recommend. But get the test again. One test doesn't mean you don't have it. Maybe you've got it now. Maybe it just took a while to kick in.
Okay, so you should have antibodies if you've gotten the vaccine.
But some of the antibody tests have been,
not accurate.
The accuracy has been questionable.
That's exactly why we get a second antibody test if they're concerned about it, because they're not 100% accurate by any means. Depends on who did it, when they did it, and once again, it may still not be accurate. Only 60% accuracy. 40% of the time, the antibody test is wrong and doesn't give you the answer.
All right. We're out of time. Zorba, thank you for your time. Thank you all for calling in. We'll do this again next week.
Thanks, Zorba. Great to see you.
Great to see you.
Final check of your forecast is coming up.